Well, one of the latest CDC travel warnings is centered around the COVID variants, plus how effective are vaccines against the variants. We're going to break it all down now and get some answers with Dr. Leo Lee, who's the Infectious Disease Specialist at Beverly Hospital. Dr. Lee, thanks for joining us once again. You know, we have spring break coming up. The CDC now warning people not to travel right now because of these variants, a rise in these virus variants. What is the likelihood of somebody bringing a new variant back to the U.S.?
Risk of bringing back really dependent on a variety of factors. First of all, destination. Where are you going? Is the COVID level very high in the country that you're traveling to? Do they have a high level of circulating variants in the area? It also depends on the type of transportation you're taking. Are you taking a plane? Are you taking a ship? Are you taking a train? Are you taking a bus? Each part of your travel actually exposes you to other travelers. If you're sitting in the terminal at the airport, you're standing with folks in the security line, in customs, you may be using the bathroom, you may be going to the newsstand, so it exposes you to many more individuals. When you arrive at your destination, where are you staying? Are you staying in a hotel? Are you staying in a hostel? Are you camping? Are you staying with family, friends? Again, that plays into it in terms of the number of exposures you have to other individuals who've been in the community. And then finally, it also depends on the type of activity you're engaging in. Are you going to be in a metropolitan area where you're going to museums, shopping? Are you going out in the wilderness? Are you going skiing? Are you going camping? So all those things add up. So each exposure over a period of time is cumulative. That will ultimately determine your risk for bringing back the COVID variant.
Dr. Lee, what do we know about how effective the COVID vaccines are against all of these variants?
Well, the two vaccines that we currently have in the U.S. appear to be effective against the UK variant. Unfortunately, for the South African variant, it doesn't seem to be quite as effective. As a matter of fact, a study published this week in the New England Journal of Medicine looked at the Pfizer vaccine, and they looked at the amount of neutralizing antibodies that it produces against the South African variant, and they found that it was about 2/3 less. And so it should be too alarmed by that. Obviously, it's a little disheartening to know that the vaccine may not be quite as effective, but it is important to bear in mind that the study only looked at one component of your immune system, the neutralizing antibodies. We do know that vaccines stimulate multiple parts of your immune system, including other antibodies, T cells, and all those things together may actually be enough to mount to a response to keep you from really getting sick.
Okay, well, that's good to know. Now, many doctors are now telling their patients not to take a painkiller before they get the vaccine. Why is that?
The reason for that is because your vaccine stimulates the immune system through controlled inflammation. Research in kids and also in animal studies have shown that when you give these anti-inflammatory agents, ibuprofen, Tylenol, ibuprofen, which is Motrin, or acetaminophen, which is Tylenol, the medications actually affect one part of the inflammatory mediators. And in doing so, the type of immune response you get after the vaccination is less robust compared to if you don't take these medications ahead of time. We do know that many individuals after receiving vaccinations do have a mild response or reaction, including sore arms, body aches, fever, headache. In those instances, for that discomfort, you can actually take medications afterwards. Should have no impact on the vaccine itself. So take it after, not before.
Take it after, not before. Okay. And talking about those reactions to the vaccine, you know, we've all heard people who have the first dose and they have a reaction, and then some people say the second dose you'll have more of a reaction. What can you tell us about these adverse reactions after the vaccine doses?
Well, based on the studies, the second dose seemed to give more of a reaction, and we actually take that as a good sign that your body is actually reacting against it. But everyone's different, and some people have actually come up to me saying that I didn't get much of a reaction with the vaccine. Does it mean that it didn't work? No, that has really no implications. Folks are just different. Sometimes you get reactions, sometimes you don't. Consider yourself lucky if you don't get the reaction, but it should be fine.
Yeah, and it's always better to get that vaccine instead of getting COVID. So,
exactly.
Right. Dr. Leo Lee, thank you so much for joining us. We appreciate it. Have a good day.
Thank you very much. Have a good weekend.
You too.